How would you feel if you could feel 20, 30 years younger, even look that way, maybe act that way, perform that way? Well, you can with a visit to Forever Young on Pass Road in Gulfport. Now, Kendrick McCarty is a nurse practitioner and the owner here at Forever Young. How are you?
Hey, nice to meet you.
Give me a little bit of background about yourself, if you would, Kendrick.
Grew up here for the most part. Been in the medical field for about 15 years now. Slowly kind of integrated through a couple different specialties, you know, and obviously landed on what I love, which is hormone replacement and wellness.
Mm-hmm. Now, Forever Young, of course, hormone replacement. We hear a lot of the different things about hormones and how they affect our lives, and especially the older that we get. As I mentioned in the opening, how would you like to feel 20, 30 years younger? Look at, perform, or whatever.
For sure.
And that's something that a lot of people deal with as we get older, but even younger.
It's funny that you say that because, of course, you expect as you get older to have changes.
Right.
You know, we're told as men we're going to get to a point where you're going to go through a midlife crisis. Women, they anticipate menopause. But I've had a lot of 20-year-olds come in and they have insufficient testosterone, which is, the more I study, is becoming more and more common. I read a study last week about comparing hormone levels about 20 years ago to men nowadays, and they're anywhere between 20 to 40% at a decline. So a lot of times, as you expect hormone replacement to be geared more towards the older generations, it's actually affecting a lot of younger men as well.
Do you think it's a lot to do with the way society has changed? I mean, things have changed so much. Our eating habits.
100%.
That's what
100%. Eating, you know, the more you look at it, obesity at its highest.
Oh, yeah. Well, Mississippi's number one in obesity.
Mississippi, there you go. Eating habits, preservatives, you know, hormones, you know. Processed food. And when I talk about hormones, I'm not talking about our hormones. I'm talking about hormones that are introduced to animals that are going to be prepared for food, for meals. You know, if you look around, you'll see kids that are they're huge now. You know, kids are developing a lot earlier. Girls are having developmental, I would say, processes happen a lot earlier than what they used to. So to answer that, yeah, it's definitely, there's a universal problem going on, whether it be diet, whether it be environmental, something's happening, and it's changing a lot of people for the negative.
Now, you know, we touched on something earlier. They always say men hit their peaks in life in their 20s, women in their 30s, and then we start declining, which isn't fair.
It's not fair.
But there are things that you do to help circumvent that.
Yes, you know, I got men that come in anywhere from 20 to 70, and you know, the big thing that they come in, they say, I just want to feel younger, you know, and I tell everyone, look, I can't turn back time, I can't make you 20 again, but I can make you feel 20 again, okay? And what that's based on is just re-optimizing hormones. You know, as a man, you lose 1 to 2% of testosterone every year. Hands down, given. It's going to happen. It's not if, it's not a possibility, it is happening. So, you know, I always tell men, anyone over 40, you can't be optimal. I don't care how you look at it, you can never be optimal, because optimal, in my opinion, is something that you are in your 20s. And you'll never be optimal again unless you have some sort of synthetic or replacement therapy that's going to help take your levels back to where they were.
So as a man myself, over 40, I'm in my 60s now. Of course, I will admit things have kind of slowed down. What do you do to work with someone like me?
First and foremost, you got to have you got to find out where your problems lie. You know, side effects are usually derived from hormone imbalances, and until you find out what the main cause or what the problem is, you can't fix it. You know, a lot of people think about age as an acceptance. You know, man, I'm just getting 60, you know, or I'm getting more tired because I'm 60. You know, it's not the fact that you're getting older. Your body's changing because you're older. Hormones change because you're getting older. It's not the age factor. So whenever you recognize that there is an insufficiency, I come up with a treatment plan to re-optimize and you as an individual. I don't classify, I don't group, I don't have protocols. I have to figure out where you are in life, I have to find out where your problems lie, and we develop a treatment plan customized to you.
Kendrick, tell us the process. I come in here for the first time, and you interview me, find out what I need and all that.
Process starts like that. You come in for initial consultation. You have a one-on-one with either myself or I have another nurse practitioner here. We gather up data, basically try to figure out what the problem is, how we're going to identify it through labs, and basically we come through and we get your blood work while you're here.
Okay, all right.
After that, blood results are reported back. We have a follow-up, and that's where we decide what the treatment plan is going to be. I say, hey, this is where we're insufficient. This is what I recommend. These are our options. How do you feel about it? So again, when I was talking about earlier, it's tailor-fitted to the patient. There is no protocol. So it's based upon what you're having issues with and how we're going to go about fixing it.
Talk about you were talking earlier about testosterone and how important it is.
Correct.
For all that, especially in the chart, how you said like 300, and if you're like 320, that's not going to work. I mean, you want to get up closer to 1,000?
Of course. So when you think about reference ranges, that's unfortunately in the clinician's world, there's always ranges, okay? And most clinicians look for normal, abnormal, okay? And that's perfectly fine. I have a different approach. I look for optimal versus not optimal, okay? So testosterone in general has a reference range anywhere between 300 and 1,000. Very big reference range, okay? So say you're having symptoms, you're tired, you're not having the best performance, in the bedroom, whatever it should be. You're gaining weight, you go and you request some blood work, and of course, you hear that your testosterone's normal, it can't be that. But if you know the number's 350, that's pretty low on the totem pole, okay?
That's not normal for you.
That's not normal for you.
Right.
Because you're experiencing symptoms. So again, when I treat the patient, that's where it has to come into a point where you're optimizing. You want to take that number, optimize it, and try to get resolution of those symptoms.
And that's where you figure out the treatment plan that they need.
Correct, yes sir. That's where we talk about it. And again, it has to be suitable for that patient. So, that's where it becomes an issue of whether or not it's accommodating or if it's not accommodating. And that's why there's different plans that we come up with.
Real quick, do they need to get a referral from a primary physician?
Not at all. No, sir. No consultation, referrals needed. You reach out, call the number. You're interested. You don't even have to give specifics on what you're having issues with. That'll all be discussed at the consultation, and then we go from there. We're open Monday through Friday, Monday through Thursdays, 8 to 5. We're closed from 12 to 2 for lunch. On Friday, we're open from 8 to 4. Still closed between 12 and 2 for lunch. And then, of course, we can come in at any time for blood work.
All right. You want to be forever young? Come visit them.